So now for the investigations of the premature rupture of membrane investigations, I've already said that you are going to still use your SchrDbb algorithm for the investigation of premature rupture of membrane. You start by investigating the disease. Is it clear? In this case, your disease is going to be premature rupture of membrane. When you want to investigate for the disease and to rule out the differential diagnosis, is it clear? So we have already spoken about the disease, the differential diagnosis in the past latter tutorial. Is it clear? So when you want to investigate for the disease first, is it clear? You need to know that what the principle of investigation is that you need to first support, then you confirm. Is it clear? That's the particular principle of investigation of the disease. Is it clear? Now you need to know that what when you want to do the investigation of premature rupture of membrane, to support premature rupture of membrane, you can just do a vaginal speculum examination. Is it clear? You do a vaginal speculum exam, as I've done already in physical examination, where you ask the woman to have a Valsalva maneuver. You do a Valsalva maneuver. Is it clear? And how do you do the Valsalva maneuver? You ask a woman to cough with the mouth closed, or you ask the woman to blow in a closed mouth and closed nostrils. Is it clear? So you're going to visualize, if you visualize clear fluid coming out from the vagina, it can tell you that it's actually a positive premature rupture of membrane. Is it clear? Now to confirm actually that there is premature rupture of membrane, you have to make sure that what the fluid that you are actually collecting and the fluid that you see in the posterior vaginal fornix, the fluid that you are collecting or the fluid you are seeing in the posterior vaginal fornix is actually amniotic fluid. Is it clear? For you to know that that fluid is actually amniotic fluid, you need to do several tests. The first test you can do the Fent test. Is it clear? In the Fent test, you take the amniotic fluid that you have collected in the posterior vaginal fornix, you place it on a microscopic slide. Is it a microscopic slide? And on that slide, you're going to have a Fent shape. If you have a Fent shape structure, is it clear? At the level of the microscopy, you're going to see that it's a positive Fent test. Now, the second one, after a positive Fent test, when you are seeing a Fent shape structure on the microscopy, when you are placing the amniotic fluid slide on the microscope, you can do also the nitrazine test. Is it clear? For the nitrazine test, you need to normally you need to know that what the vaginal fluid, is it clear? The vaginal fluid is generally acidic. Is it clear? So that's why if you have a leukorrhea, is it clear? If you have a leukorrhea, is it clear? Generally, when you have a leukorrhea, it's going to be when you have a leukorrhea or a vaginal discharge, generally it's going to be acidic and it's going to convert blue nitrazine into yellow because it is acidic. Is it clear? But now we need to know that what amniotic fluid is not acidic, but it is basic. So it's instead going to convert yellow nitrazine to blue. Is it clear? You can also do another test with litmus paper. Is it clear? You do a litmus test, and with the litmus test, it's going to convert, since the amniotic fluid is basic, it's going to convert the red litmus paper to blue. Why? If it is vaginal fluid, it's going to convert instead blue litmus paper to red. Is it clear? So those are the different elements that you have to evaluate to visualize for if it is actually amniotic fluid. Now, the next element that you can visualize in order to see if it's amniotic fluid, you are going to have you have also the alpha fetoproteins. Is it clear? You can measure the level of the alpha fetoproteins at the level of the fluid that you measure. You are going to have a presence of alpha fetoprotein in the case of amniotic fluid. Is it clear? So that is the next element that you visualize in order to know that it is amniotic fluid that is located at the level of the posterior vaginal fornix. So that's how you make a diagnosis of the premature rupture membrane. To rule out the differential, we said that one differential could be gravitic hydrorrhea. Is it clear? And that gravitic hydrorrhea is not going to have those positive findings for the investigation. Another differential can be a heavy leukorrhea. Is it clear? So those are the different elements that you have to visualize in this case. Now, the next thing that you have to investigate is we're also going to be investigating for the complications. Is it clear? The major complications that we said is going to be associated with oligohydramnios. Is it clear? So if you have oligohydramnios in this patient, it means that you can see it on the ultrasound, obstetric ultrasound. You can visualize oligohydramnios. Now, these oligohydramnios can result to fetal malformations. As I've said, we are going to have certain fetal malformations associated with the musculoskeletal system, like the crop foot, associated with the kidney, like renal hypoplasias, associated with the GI tract, like the duodenal atrasias, and associated with the lungs, like lung hypoplasia. If you have those fetal malformations, it can also be seen on the ultrasound. You can have also acute fetal distress. Acute fetal distress, the investigation for that is the ultrasound with the biophysical profile. Is it clear? With the biophysical profile, where you evaluate for the Manning score. Is it clear? And then you also do, after the ultrasound, you also do the pH of the scalp blood of the fetus. pH of the scalp blood of the fetus to find if the pH is less than 7.2, which shows acidosis. When you have acidosis, it's going to confirm that actually it's acute fetal distress. Is it clear? And now to support the acute fetal distress, you can use the cardio tachograph or just by the fetal heart rate monitoring, where you can support first by having fetal tachycardia or bradycardia, and final confirmation based on the cardio tachograph that the patient is actually having a acute fetal distress is a fetal variability. Fetal variability is equal. If the variability is less than 5 in the fetus, it is a high risk that the patient is having acute fetal distress. Now, the next thing after the